Hi guys, this is Dr. Bhupesh once again for you all from Dr. BKM OET Institutes. Our contact number is 76967342256. You may contact us for the best OET coaching and subscribe our channel if you have not until now, even though you are preparing for OET. So I have used a complex sentence to make you better at reading and listening by using the word even though. So please try to listen to it again, try to understand the meaning of even though. But yeah, main point I'm discussing now is the writing. All right, there you go. That's the main thing we are discussing today. Please understand, first of all, obviously, we guys are very much happy when somebody teaches us, oh, it's a discharge letter. Oh, it's a visit letter. Oh, it's a discharge letter. We get super excited. Oh my God, this teacher is the best teacher in the world and he knows what OET is. Guys, I'm sorry to say, but this I'm using these words for you, but actually you should not do so. You should understand what the patient is all about. Okay, I will help you in understanding what I am trying to say. Okay, discharge letter means that somebody was hospitalized. Now he is better, so he is being discharged, and now after discharge he requires follow-up care. Obviously, when a person was in the hospital, he must improve, and then he requires follow-up care. So you are writing the letter to nurse. It can be she can be district, or he can be district nurse, or he can be community nurse. This is the letter. So we call it discharge letter just because patient was hospitalized. So if there is any hospitalization given, that means it is a discharge letter. Please understand. Simple. So you don't have to say even this is a discharge letter. You can simply say this is the thing. You can see if the patient is hospitalized, then he is getting discharged. It is actually a follow-up care letter. Main thing you should say, you should have habit of calling it kind of follow-up care letter. I'm not saying in a wrong way. Don't now you don't have to name it. I'm just telling you. This is this is better to be said. Follow-up care. Because the patient was hospitalized. So that means this is the main thing. And follow-up care in these kind of letters is given in the word discharge plan. So discharge plan is the purpose of the letter. This is the main purpose, discharge plan. Because we are writing to a nurse, we want her to follow this discharge plan. This is the main purpose. We want that nurse to provide follow-up care. This is the main purpose. So how do we write it? Okay, how do we write it? Okay, I'm writing it for you. I'm writing to refer Mr. X who needs follow-up care. That's it. First paragraph over. This is the purpose. Now that's the problem. Oh, it's too small. That is why I say best method, because this is too small. So how do you make it better? So you will say, I'm writing to refer Mr. X who was admitted to our hospital due to this thing. So you tell about the problem. So now it is making a story. That is why I call this as a better method. This is what Dr. BKM's method is. And this is what will fetch you 390, 400 marks. I'm writing to refer Mr. X, or you can say I'm writing this letter regarding Mr. X, who was admitted to our hospital due to this. So what happens in the hospital after treatment? His condition has improved. That is what happened. That is what happens. But he still needs follow-up care for further recovery. Therefore, he is being referred to you. Now, this is the best method. It completes the story. And some people say, oh, sir, this is a discharge letter. This is not a referral letter. When you are using the word he is being referred to you, obviously it's a refer. Every letter is a referral letter. Every single letter is a referral letter because sometimes you are referring to the nurse. Sometimes you are referring to the specialist, sometimes you are referring to this person. Every letter is a referral letter. Don't get confused about a referral letter. All these letters are referral letter, all the 4 letters. So letter number 1, done. This can come in the exam. This is how you will write the first paragraph. Second paragraph, like all the letter would be same, you will write social history or medical history. The chances are less that this kind of letter will come, but again, it has not come for a very long time, so it can. Third paragraph would be about during hospitalization. In this paragraph, you just have to take care of the tenses. During hospitalization, the patient was given this and this thing. Suppose if the patient was admitted due to myocardial infarction, that means heart disease. So you would have placed the stents after doing bypass surgery. Suppose if you have done bypass surgery in the hospital. His condition has improved, but he still needs follow-up care. Therefore, he is being referred to you. Social history is a smoker. He drinks as well. This and this and this. During hospitalization, bypass surgery was done. And then whatever you did, then dressing was done, whatever. You know better story because you are the nurses. You know better than me. So you write the story. In this, the major tense would be was plus third form, passive voice. The last paragraph of these kinds of letter. You are writing to a nurse. This is the main paragraph. What is the purpose? First is this. He still needs follow-up care. Therefore, this is the purpose. Now, follow-up care would be explained in a better way. It would be greatly appreciated. This is the method for the last paragraph in these kinds of letter. If you could educate the patient regarding good diet and exercise. Means that is how you write the discharge plan letters. And the first line of the last paragraph, which is the most important paragraph after this line. After this line, this is the main paragraph. This would be written like this. It would be greatly appreciated if you could educate the patient regarding good diet. In OET, every point like this is given. I am telling you the sentence formation. This is the main thing I am teaching you. This would be given. Always make some kind of passive voice. Suppose if they are saying encourage the patient to visit the community health center to quit smoking. So you will write passive voice always. Always. That means he or she should be encouraged. This is passive voice. Rest all the sentence remains same. Whatever is given. He should be encouraged to quit smoking. And for this, he needs to attend counseling sessions in quit smoking program. Means what I want to teach you by these small things, always make a passive voice. He should be encouraged. B plus third form. This is the passive voice. So always show variation to the examiner that you know grammar. So this is the first type of letter, so-called discharge plan letter. In this letter, you're normally saying that patient is better now, but he needs follow-up care. Then you explain the follow-up care that educate. Then I'm telling the nurse you should educate the patient about good diet. You should encourage him to quit smoking. This paragraph decides the data selection. Means if I'm writing quit smoking, that means in social history I have to write that Mr. X is a smoker and smokes 10 cigarettes. Means the whole of the data that you are writing in these 2 paragraphs is all dependent upon this. Means when you get this kind of discharge letter, then discharge plan is the main thing. This is the main purpose. I hope you all are understanding. If you do not understand anything, pause this and listen to this again. And you guys are saying the last time discharge back letter has come. So obviously we are expecting this letter. So first, maximum chances is this visit letter. Second chances is this, because obviously they will shuffle it. But discharge back letter can repeat too. So I am telling you how to write discharge back letter. Now What I told you, what is discharge letter? Now suppose before the patient got hospitalized, he had a chest pain. So I'm writing it. Please understand what is the difference between discharge letter and discharge back letter. Chest pain. So in foreign countries, whenever you have any problem, you go to your GP. So he went to GP. What will GP do? GP will examine the patient. GP will see the examination and he will feel that it can be a heart attack. It can be myocardial infarction. It can be something else. So what he will do, he will refer the patient to hospital. Then patient will go to hospital. He will have the ECG done. After ECG, he will be hospitalized. Now this is the story. The only thing happens in discharge back letter is patient goes to a GP first. And patient gets hospitalized. He becomes better. So he is discharged. Patient is better now. So now the follow-up care would be provided by the same GP. He is patient's GP. So the letter started with GP. The letter is ending with GP. GP mean you can say MBBS doctors. So patient went to an MBBS doctor. He said, "Oh my God, you might be having a heart attack. You go to a hospital." He goes to a hospital. There he gets examined, ECG and all that stuff, and he gets to know that he needs bypass surgery. He gets the bypass surgery done. Now he's better. He's being discharged. In this case, kind of cases, GP is the doctor who will provide the follow-up care because he knows the patient already. Even though GP will also appoint a nurse to provide the follow-up care, but my letter is to write to GP that, sir, now he is your patient, he is better now. We are in the hospital, we are having so many patients who require surgeries. We are here for the surgery. You are the GP, you are the local GP. Please provide him follow-up care. So now what will change? I am writing to refer your known patient. That is the main word. So I'm putting it in capital words so that you can understand the patient. I'm writing to refer your known patient who was admitted to our hospital due to MI. After doing bypass surgery, his condition, but he still needs follow-up care for further recovery. Now you will change only last line. Being his GP, you are requested to provide him the required care. That is the only thing that will change. Rest, all the letter will remain the same. Now one more thing. The patient has already visited GP. So GP knows about him. So in this kind of letter, social history and medical paragraph is not there. So the second paragraph one becomes during hospitalization paragraph. And fourth paragraph can be split into two parts because there would be lot of follow-up care. So that is how this letter varies. So this is the only pattern change that happens. Again, please listen to this letter. I'm just trying to make it easy for you, but you have to spend time with this video. So I'm writing to refer your known patient, Mr. X, who was admitted to our hospital. To GP, you can also say who was referred to our hospital because we are telling the GP that who was referred by you to us. So you can also use this word. I'm writing to refer your known patient, but refer word is not uh, appearing nice. So I'm changing. I'm writing regarding your known patient. Now this is better. Refer word two times in one line is not sounding good. So that's why I changed it. I'm writing regarding your known patient, Mr. X, name the patient, who was referred to our hospital due to MI. After doing bypass surgery, if by chance, if we have to make the complete story, so he was referred to us due to chest pain. So after doing ECG and other tests, he was found with MI. So bypass surgery was done. This sounds more logical. Now you can read the whole story. I am writing regarding your known patient, Mr. X, who was referred to our hospital due to chest pain, severe chest pain. After doing ECG, he was found with MI. So bypass surgery was done. His surgery was done and his condition has improved, but he still needs follow-up care for further recovery. Being his GP, you are requested to provide him the required care. So now this letter is coming from GP who was referred to our hospital and going to GP. That is the difference. That's it. Please think about it. It is not difficult at all. You just need to spend time with this video. Listen to it 2 times, 3 times. Very easy. Because the patient was coming from GP, going back to GP. That is why we are saying, na, it is a discharge back letter. Back means we are referring back to GP. Okay. This is also a referred back letter. So both the letters are equally same, but I will not confuse you at the moment by splitting. These two letters are little different, but I am not doing it at the moment, just not to make you confused. So first letter we have covered is discharge letter, simple. Second letter we have covered is referred back letter. In this, social history and medical history is not written. Not written. That is the main thing, because GP already knows about it. First paragraph would be like this. I have explained you thoroughly. Now the main letter that can come this week, but the easiest of all, the easiest of all. Now try to learn this pattern. Visit letter. What is a visit letter? Please understand. Visit letter means patient came to clinic. I am a nurse at GP clinic, or I myself am GP. For the case of doctors, this is the most common letter. After this, for nurses and doctors, for doctors, discharge letter will not come, but referred back letter is very common. And this is the letter that is this is the letter that is common both for nurses and doctors. Just like the referred back letter, this letter is also very common. Both for medicine, maximum this type of letter, and nurses also this type of letter. Now, what is happening in this letter? We are at the GP clinic, whether you are a doctor or a nurse. Please understand. Aram se bilkul. Take it lightly. It would be very nice. So at GP clinic, patient comes on 28th January. Then he comes on 30th February. Then he comes on 15th March, maybe. Various dates will be given. Many dates would be given. And patient would be coming again and again. But the problem is that patient is not getting well. So what will you guys do? Suppose if you are a nurse at a GP clinic, or if you are a doctor, you yourself are GP, what will you do? You will refer the patient to a specialist. That is the main thing. So these kind of letters are the visit letters. So how to write about it? Simple, very simple. This letter, or I am writing this letter, or this letter is being written. This is applicable for all. Don't worry whether you are in the habit of writing this letter is being written, or I am writing this letter. Doesn't make a difference. This letter is being written regarding Mr. X, who who has been visiting our clinic since first date 28th January. Even after, I'm just writing facts. Please understand how simple it is. Even after providing treatment, his condition has not improved. Now he is suspected with, there would be a problem given that he is suspected with multiple sclerosis, he is suspected with myocardial infarction, because, or he is suspected with back pain which is not getting relieved. So means you will be given a main diagnosis. So you will write that thing. So that would be the main purpose. He is suspected with this. Therefore, he is being referred under your expertise. Please understand. I'm repeating it again. Don't worry. This is the main thing. This letter is being written regarding Mr. X, who has been visiting our clinic since right the first date. You will automatically get good marks. Present perfect continuous tense. Has been ing since and since with since. it is graded as A level of grammar in OET, that this person knows grammar very nicely. Passive voice and these kind of sentences are known as very good level of grammar. That these are the people who get A score 450 for writing grammar. So this letter is being written regarding who has been visiting. Even after providing treatment, his condition has not improved. Now he is suspected with this thing. Therefore, this is the main purpose. I am writing this tense to improve my grammar. Otherwise, I can also write Mr. X. Otherwise, if you want to write very simple, this is the main purpose. So you can write this way. This letter is being written regarding Mr. X, who is suspected with this thing. Therefore, he is being referred under your expertise. You can make it that simple. But again, as I told you, Dr. BKM's pattern, we love to talk about things. That patient came to us on this tarikh, but his condition has not improved, doctor. You are the specialist, that's why I'm referring. So it completes the letter. Again, rest of the letter remain the same. Medical history, social history. Again. Third paragraph, you will write about first date. On 28 January, he visited with chief complaints of. Now I'm telling you grammar as well. This grammar will be same that will happen in the during hospitalization. On 28 January, he visited with chief complaints of A, B, and C. You will write the chief complaints. Then everything will become passive because now everything will be done by you. Passive means was plus third form. On examination, he was found with whatever the signs are given. So on 28 January, he visited with chief complaints. On examination, he was found with this thing. This is a very nice word. At that time, he was suspected with this thing, for which medicine was given. Means everything will go in the passive voice. Main thing I want to teach you is tenses. Was plus third form, was plus third form, was plus third form. Only in the first line it can be active because patient comes by himself. Rest is all passive. On examination, he was found with this at that time. Visit letters are very simple because this is the first visit. Suppose if I have to write second visit on 30th, then I will say on 30th February. He visited again. Little bit of shuffling of some sentences and complained of. It's just to change the wordings. Otherwise, I am writing same and complained of A, B, and C. On examination, he was found with, he was assessed with, just changing of words. I will remove this because I don't want to repeat it. Therefore is also a good word. He was having these symptoms. He was having these signs. Therefore, he was suspected with this, for which this medication. Means second paragraph will also remain the same in grammar and everything. You can change this word visited. You can change this presented if you want to. That's it. Now is the main grammar change in today visit. So you can make 5 paragraphs as well in visit letter 1, 2, 3, 4, and 5. Today is the main grammar change. Today he has presented with. So the only grammar change, if you understand, rather than second form, has come, has plus third form, present perfect. Today he has presented with this thing. On being examined, this I am changing just because it's the same word. On examination, you can change this word by after assessment. Please spend time with this video. I understand you would be little bored, but again, I'm telling you the pattern and this is the main thing that can come. Today he has presented with this and this on being examined. So I've changed the words. On examination has been changed by after assessment. After assessment has been changed by on examination. And this is the grammar he has been found with. So now I will copy paste again. Yeah. So on being examined, he has been found with So only change I am doing is was is being replaced by has been. Therefore, was changed by has been. Medicine was given, has been. So this is the main grammar change that happens in today visit. Today he has presented with this. On being examined, he has been found with this. Therefore, he has been suspected with this, for which he is being referred to you. In the last visit, you will say, na, he is being referred to you. Please try to, I have done it little fast because I'm putting everything in recording today. So you will get the recording of it. Please spend some time with it. I've tried to make it as simple as I can, especially for the people who are having exam. Please watch this video. Anybody who is new as well can watch it. And this will help you to resolve every problem regarding grammar in your OET writing. This is Dr. Bhupesh from Dr. BKM OET Institutes. I was little fast today, but I had to do reading as well as writing. But again, you have the video, you can watch it multiple times, you can pause it, can listen to it again, but you will understand everything. That's for sure. This is Dr. Bhupesh from Dr. BKM OET Institutes. Thank you.